So for our presentation, we did barriers to healthcare access for individuals with IDD. So for some primary barriers to healthcare, so for financial barriers, for many individuals with intellectual and developmental disabilities, cost estimates can vary depending on specific factors. For example, for some families, their children are covered for some of their expenses through private insurance policies. However, other children and a majority of adults rely on Medicaid, Medicare, and other public finance options for healthcare. As we know, IDD patients usually have much higher expenses with healthcare needs compared to the general population. So in general, this can be a major barrier for individuals having support through insurance. However, individuals who may be paying out of pocket or low income families can be greatly impacted with having to deal with cost of frequent doctor's appointments, medical equipment, and specialized therapies, including occupational therapy, speech therapy, and even dentistry. So for some structural barriers, caregivers and patients can deal with complications with lack of provider training and support for IDD patients. There seems to be a major shortage in appropriate mental health treatments that provide a comfortable environment for these patients because specialists are not being trained to work with IDD patients. By having lack of this training, this is leading to poor coordination within facilities with healthcare providers, causing many complications and confusion for the patients. A major component that is usually not discussed is the caregiver within these barriers. And if there is not balanced and organized healthcare providers for the family, this can cause lack of relationship and support for the caregivers do put the immense amount of energy and work into providing the best care for their loved ones. So for cognitive barriers, communication is a major component when working with any client in healthcare. However, this can be difficult for individuals with IDD when trying to understand advanced medical information and overall health needs. Healthcare systems can already be very complicated for the general population. So for individuals with IDD, many limitations come into play with having to deal with the cognitive abilities such as memory, language, processing, and reasoning, which leads to inadequate treatments and diagnoses and poor health outcomes. And for cultural barriers, IDD patients can come from very diverse cultural backgrounds, languages, and practices. Specifically, religious beliefs can lead to attitudes towards disabilities and healthcare practices. For example, some cultures seek out the spiritual healers and alternative medicines, and some even express their beliefs that disabilities are caused by possible influences of past lives, which is leading to religious acceptance within these specific cultures. And another major cultural barrier is the overall communication aspect when working with the patients. So lack of communication can lead to issues such as families trying to seek out resources that respect their cultures. Specifically, a major factor is the medical competency within healthcare professionals. Some scenarios that these families do have to deal with is lack of professionalism with specialists. As a healthcare providers, it is our job to follow by our facility's legislation and protocols when working with these patients and their families to provide comfortable and respectful environments to fulfill not only the patient, but the caregiver's needs. So for geographic barriers, specifically in facilities, depending on the patient's area, there can be a major lack of healthcare facilities near them, leading them to having to go long distances to receive necessary care. So when discussing medical equipment, this can be a major complication for IDD patients. Trying to getting affordable access to adaptive equipment can be very complicated for individuals with disabilities. And there's also the factor that many people do not have to possibility to accessible entrances for specific facilities. And we also I don't want to be going into too much detail because we do discuss this later, but transportation is a major impact on some of the individuals with IDT. So some rural communities majorly rely on non-motorized transportation, which can also cause major difficulty finding accessible transportation to local healthcare facilities and urban centers.
So going into the impact and for financial barriers, there are obviously different insurance plans that have limited coverage, which leads to limited resources for the family or the individual. This can lead to delay of treatments and less doctor visits, which can also then eventually lead to unmet healthcare needs and more issues can develop in the future. And without insurance coverage, many IDD patients do not have all their needs met or are unable to get any sort of provide um, healthcare providers and structural barriers. A small number of healthcare providers leads to case overloads. So instead of a health provider having a few cases a day, they will have a lot more, which can lead to a decrease in the quality of care and also be harder for the healthcare provider. And then the caregiver's role is essential for these individuals. So with very little resources for the caregivers and the support, and it also leads to decreased involvement and access. So then looking at the cognitive barriers, there are decreased health literacy, which leads to an increased risk of medical errors. So this can be based on communication difficulties caused from, oh my gosh, sorry. Communication difficulties cause information to be misunderstood or not acknowledged either between the patient or with the healthcare provider. And this can lead to unmet healthcare needs due to the miscommunication. And understanding the healthcare and medical information can be challenging for some individuals with IDD. So this can lead to poor treatment or wrong or misdiagnosis and negative health status or a health decline. And some cultural barriers, the cultural differences can often lead to misunderstandings between the patient and the healthcare provider. And there's also stigmas within the healthcare realm. And this can lead to internalized ableism for these individuals, so they can distance themselves from others with similar disabilities, so they're not able to connect on that level. Then geographic barriers, there's facility accessibility. So the lack of accommodations makes it harder for patients with IDD to get care, and it causes less motivation and a lack of trust with the healthcare system and the facility because they are not able to even access their healthcare provider. So this can also take away a lot of their autonomy with their care that they're able to receive. And transportation challenges with getting to and from healthcare facilities can increase their lack of motivation to seek healthcare.
Okay, I wanted to touch on a few of the barriers we talked about earlier and how to overcome them. So this first one I think is really important, and it's it's addressing the shortage of direct support professionals, which a lot of individuals with IDD rely on these people to help them get to their health services, appointments, help them take care of themselves, and a number of things. But something that's really important, there's a shortage because of the decreased wage that they have in place right now. So it's important to so the American Rescue Plan is a pandemic relief fund that is active through March 2025, and all the funds that were allotted from this plan are supposed to be used up by 2025. So because of that, there's a need for more funding to increase and maintain the retention of direct support professionals now. And in 2022, the hourly wages for the direct support professionals reached 1579, which was the highest it has ever been in history. But the turnover rate for these professionals was still over 40%. So it's important to just maintain a higher wage and potentially increase the retention rate as well, so that people with IDD can access the services they need and with the professionals they need. And recently this year, the Pennsylvania state budget allotted $280 million for specifically increasing the wages for these direct support professionals in the state. And so many people with IDD rely on these support professionals to receive that care that they need. And the wait list for actually getting to have a direct support professional is 10 years long. So people that need them and can get them are still waiting because there's such a shortage. Yeah. And so then there's also the financial barriers. Overcoming the financial barriers is really important. A lot of people with IDD don't have jobs or sustainable jobs really with good finances. And if they do, sometimes they don't have the ability to manage their finances. So there's the National Disability Institute's Financial Resilience Center that offers services to help individuals with IDD manage their finances. So tell them how they can pay for certain things, how much things cost, and what to do with their paychecks if they have a job. Specifically, I think it's important to increase advocation for the health needs of people with IDD and just really emphasize the need for more funding in these areas and for different programs that can help them with their finances and also help decrease the costs of their health care and transportation to their care. UPMC Project Search is a 1-year program that helps individuals with IDD have a career. So it's a 1-year school to work program. They do 1 year of rotating in different areas of the hospital, and they kind of learn what kind of jobs work for them and which ones don't. And it helps them enter the work field and apply for competitive jobs with competitive rates. And so I think programs like Project Search should be implemented across the country to increase job opportunities for these individuals and give them a sense of financial independence as well. And then lastly, I wanted to talk about transportation issues. So the transportation systems there are a lot, but they're not always able to access people in underserved or rural communities, especially. The Access Paratransit system in Allegheny County offers a shared ride experience for individuals with IDD or other disabilities that are not able to use the public transit or those who don't have other means of transportation, like a family member or a friend or a direct support professional. So the major problem with Access consists of long wait times for rides. It's kind of unreliable at times, and a complicated application process and an overall lack of awareness about the services altogether. So, hiring staff to help work through the barriers with this program can help increase transportation access. So, hiring someone trained to work with individuals with IDD who can work directly with the individuals on the application process would be helpful in eliminating that challenge. And increasing the program to include more vehicles, more drivers, and reach more locations would be helpful with decreasing wait times for rides and increase the reliability of the transportation.
So for one of our organizations, we chose the World Institute on Disability, and their overall mission, completely taken from the slide, from the site, is that on a global scale is to continuously advance the rights and opportunities of more than 1 billion people with disabilities. So their vision is that at some point, individuals with disabilities can live in a world freely where access, inclusion, equity, and resilience are implemented throughout every community globally. So some of the advantages that we had found was that they help assure accessible products and services. They help promote equity policies, providing consulting services for all clients, offering proper training and adaptive tools for individuals with IDD, and as well as show support during emergency, disaster, and climate efforts. And for disadvantages that we found, there was not really any known disadvantages with the WID. However, the possible challenges with providing personal care services to people with disabilities.
Then for Access Living, their mission statement is we challenge stereotypes, protect civil rights, and champion social reforms. We are located in Chicago and have a long history of doing what it takes to make sure people with disabilities can live the lives they choose. So some advantages were they helped provide home and community-based services, housing services, youth programs, consulting and training for businesses and nonprofits. They also serve multiple different racial and ethnic groups from around Chicago. And the main disadvantage that we thought was it only services the Chicago area. So individuals in Pittsburgh that we may be treating or in the general Pennsylvania area cannot use this resource, but I think this would be a great resource to expand beyond Chicago.
The other organization we wanted to talk about was the Disabled Persons Protection Commission, and their mission is to protect adults with disabilities from the abusive acts or omissions of their caregivers through investigation oversight, public awareness, and prevention. An advantage of this program or organization is that it conducts abuse investigations, implements protective services, and maintains the abuser registry. So it's a great example of an organization made to protect those with IDD and hold those accountable who abuse or neglect people with IDD. So creating organizations like this nationwide could prove to be extremely beneficial in the prevention of abuse of these individuals. The only disadvantage we saw was that it's based only in Massachusetts, so it can't serve any other city or town. And then, so one aspect that we wanted to talk about in low income countries that contributes to intellectual disabilities is maternal health. maternal health, there are several factors that contribute to giving birth to an individual with IDD, which include their access to healthcare. A lot of times in like intellectual disability is associated with many risk factors, including the lack of access to child and maternal health and nutritional services. A study that was conducted about over 3 decades aimed to quantify the global burden of intellectual disabilities and categorized the findings by sex, age, and socio-demographic. And the results of the study revealed an increased number of diagnoses of IDD, especially in low-income regions of the world compared to higher income regions. So these remarkable differences in prevalence rates and rates of new diagnoses indicates a significant inequity among populations of lower socioeconomic status. And many low income countries are more rural than developed or higher income countries. And so distance to healthcare and transportation to healthcare also becomes a challenge. This lack of access is linked to higher risk of a child with IDD. And the difficulty to access healthcare may deter mothers from seeking it out, so not getting the care that they need at all. And countries like Africa have inadequate access to maternal health services, which has been directly linked to an increase in prevalence of maternal mortality as well. But poverty overall is directly and indirectly impacts children, which can cause or lead to the development of IDD. So this is true for many instances, but especially with a lack of prenatal care, lack of maternal or parent education regarding health, and access to secure housing. So many of these factors may contribute to the health of the baby and increase the risk of IDD. There are also financial hardships. So in lower income countries, it costs money to seek healthcare and seek good healthcare at that. So it contributes to accessing transportation as well. So everything really comes down to the financial hardships and just getting access to the health services that are available if they are.
So for education and early developmental programs, so an article that I had found had taken publications from 1920 to 2020 and had collected immense research discussing the many determinants of intellectual disabilities in children and adolescents. And data had shown that an increased risk of IDD in offsprings were to the mothers that had a lower education, specifically in the minorities such as Indigenous, Hispanics, and African American population, representing the lower access to education, majorly impacted by poverty and discrimination. And another factor that was a major factor in the research was the lack of access in special education programs in public schools.
Okay, so going into a little bit of the prevalence with low income countries and people with IDD, there is at least 10% of the global population has a disability that would be characterized under IDD. And there is a higher concentration of individuals with disabilities in low income countries. So this already causes a big disadvantage for individuals with IDD in low income countries. And some of the general major risk factors of this are genetic diseases are more prevalent in low income countries, which whether it's from never mind. Then more births or to older females can increase the risk of a baby having a disability. There is also trauma and toxins exposures are higher because they have less control over these things, and consanguinity marriage, which is marriage with close relatives, is a lot more common in these low-income countries, which can lead to more disabilities.